Good morning, colleagues and neighbors of District 13. I stand before you today to talk about a crisis unfolding right in our backyard in Howard County, and the crisis sitting at the intersection of life-changing medicine, broken prescription pricing, and runaway healthcare budgets. Over the past few months, I have heard from many Howard County employees, teachers, cafeteria staff, bus drivers, and hardworking families across District 13. People who are prescribed Wegovy by their doctors to treat chronic weight loss, manage severe cardiovascular risks, high blood pressure, type 2 diabetes, high cholesterol, and prevent debilitating long-term illness. These patients finally found a treatment that worked. But then came the devastating news. The Howard County Public School System dropped coverage for GLP-1 weight management drugs, leaving thousands of public employees stranded. Now, let me be clear. I do not blame our local school board or our county administration. They were backed into an impossible financial corner. In just 2 years, HCPS saw its quarterly spending on these medications soar from $485,000 to over $3.6 million. Absorbing that explosive cost would have meant spiking employee healthcare premiums by nearly 20%, or ripping tens of millions of dollars directly out of our classrooms. This is an impossible choice. We cannot force our county governments and school systems to choose between funding our children's education and covering essential doctor-prescribed care for our workers. The problem isn't that these medicines don't work. Science proves they do. The problem is an extortionate prescription pricing system that forces local taxpayers to carry the bill. That is why I would like to solve this state-level policy package to reform prescription coverage and protect our local communities. First, we will leverage the full power of the Maryland Prescription Drug Affordability Board. Maryland led the nation by voting to set upper payment limits on high-cost GLP-1 tests for government health plans. I would like to fast-track these upper payment plans so state and municipal plans are no longer charged inflated prices for prescription drugs. Second, I would like to mandate state-negotiated purchasing pools. By bulk purchasing GLP-1 medications alongside state employee health plans and county jurisdictions across Maryland, we can negotiate deep, high-volume rebates directly with manufacturers. We can significantly reduce the per-patient cost to a fraction of today's price tag. Third, we must reform insurance prior authorization rules. We must end predatory carrier practices, where insurance providers deny coverage for preventive weight management only to pay hundreds of thousands down the line for heart attacks and strokes. Preventive care is one of the most effective investments a state can make, not only by improving health outcomes and saving lives, but also by significantly reducing long-term healthcare expenditures. Howard County's crisis is a preview of what every jurisdiction in Maryland will face if Annapolis fails to act. No teacher should ever have to choose between affording their medicine and the corporate pricing set by drug companies. I ask for your support on this legislation to deliver real prescription drug affordability to District 13 and every family across the state of Maryland. Thank you.